Welcome to today's video on Health 365 Day. I want to start with a simple but powerful question. What if your body has already been trying to warn you about heart trouble, and you just haven't realized it? Every single year, more than 6 million Americans live with heart failure. What's truly concerning is that most people don't recognize the early warning signs until the condition has already advanced, and by then, treatment is much harder. Here's the truth. Medical research shows that people often dismiss these symptoms as just getting older, or they chalk them up to stress, or even being out of shape. But in reality, these small changes are often your heart's way of waving a red flag, begging you to pay attention. That's why today we're going to look closely at 13 early signs of heart failure that most people completely overlook. Some of these may surprise you. For example, there's a strange symptom that shows up when you bend over to tie your shoes, or why some people suddenly find themselves stacking extra pillows just to sleep through the night. By the end of this video, you'll know what to watch for and when to take these signs seriously. And remember, this content is for educational purposes only. It's not a substitute for medical advice. If you're concerned about your health, talk to a qualified professional. With that said, let's dive in. Sign number 1. Shortness of breath with everyday activity. One of the earliest warning signs is shortness of breath when doing activities that used to be effortless. This isn't about running a marathon or finishing an intense workout. It's about struggling with simple things like walking to the mailbox, climbing a single flight of stairs, or even doing light household chores. According to the American Heart Association, this is called exertional dyspnea, and it's one of the most common early symptoms of heart failure. Here's why it happens. When your heart isn't pumping efficiently, your muscles don't get enough oxygen-rich blood during physical activity. So, your lungs kick into overdrive to compensate, leaving you feeling breathless. The key here is noticing the change. If activities that were once easy now leave you needing to stop and catch your breath, it's more than just getting older. In fact, studies show this symptom can appear months before other obvious signs of heart failure. Don't dismiss it. Your body is telling you something important. Sign number 2. Needing extra pillows to sleep. Have you noticed yourself stacking pillows at night just so you can breathe better? That's not just a quirky habit, it could be orthopnea. Orthopnea happens when you feel short of breath lying flat and need to prop yourself up to breathe comfortably. It's a classic sign of heart trouble. Here's what's going on. When you lie down, gravity no longer helps your heart move blood back up from your legs. If your heart is weakened, blood can start backing up into the vessels in your lungs. This causes fluid buildup, which makes it harder to breathe when you're flat on your back. Research shows that orthopnea is present in up to 80% of people with heart failure. And what's tricky is that it often sneaks up gradually. You might start with 1 extra pillow, then 2, and before long, you're sleeping in a recliner because it's the only way you can breathe comfortably. It's easy to shrug this off as just a comfort thing, but if you've noticed this change, it's a sign your heart is struggling. Sign number 3. Waking up gasping for air. Imagine this. You're asleep, and suddenly you jolt awake, gasping for air, heart pounding, feeling like you're drowning. This frightening episode has a name: paroxysmal nocturnal dyspnea. It happens because fluid that has been pooling in your legs during the day redistributes when you're lying down. If your heart can't handle the sudden fluid shift, it causes acute shortness of breath that literally wakes you from sleep. Clinical studies show this usually happens 2 to 4 hours after falling asleep. People often describe rushing to an open window, desperate for fresh air. Now here's the danger. Many people dismiss these episodes as nightmares, anxiety, or even sleep apnea. But if you're waking up gasping for air, especially if it's becoming more frequent, it's a red flag that deserves immediate medical attention. Sign number 4. Persistent fatigue and reduced stamina. We all get tired, but the fatigue linked to heart failure is different. This is a deep, ongoing exhaustion that doesn't go away with rest. It's the kind of fatigue that makes simple daily tasks feel like climbing a mountain. Here's why it happens. When your heart can't pump enough blood, your body prioritizes where the oxygen goes. Vital organs like the brain and heart get first dibs, leaving your muscles with less. That means even light activities leave you drained. What's especially concerning is how this fatigue affects your stamina. You might notice that recovery time after even light exercise is much longer than before. A short walk leaves you wiped out. Carrying groceries becomes a struggle. Even showering can feel exhausting. the progression is often so gradual that people adapt without realizing it. They avoid certain activities, make excuses, or simply blame it on age. But this persistent, worsening fatigue is not normal aging. It's your heart struggling to meet your body's needs. Sign number 5. Swelling in the legs, ankles, or feet. One of the most visible signs of heart failure is swelling in the lower body, especially the ankles, feet, and legs. Doctors call this peripheral edema. Now, this isn't the temporary puffiness you get from sitting too long. This swelling is persistent, often worse by the end of the day, and gradually increases over time. Here's the science behind it. When your heart doesn't pump effectively, blood starts to pool in your lower extremities. At the same time, your kidneys getting less blood flow respond by holding onto salt and water. That combination forces fluid into your tissues, causing swelling. Research shows that about 70% of people with heart failure develop this kind of swelling. It often starts in the feet and ankles, but can move up into the calves and thighs. You might notice socks leaving deep imprints, shoes feeling tight by evening, or rings becoming snug. Heart failure-related swelling usually affects both legs symmetrically, and pressing on the swollen area often leaves a dent that lingers for several seconds. This is more than cosmetic, it's your heart and kidneys sounding the alarm. Sign number 6. Sudden weight gain. One of the most measurable and overlooked warning signs is rapid weight gain caused by fluid retention. This isn't about overeating or gradual weight gain. We're talking about a sudden jump on the scale, 2 to 3 pounds in a single day, or 5 pounds in just 1 week. According to the American Heart Association, that kind of change warrants an urgent call to your healthcare provider. Why? Because every kilogram gained equals roughly 1 liter of excess fluid trapped in your body. Here's how it happens. When your heart weakens, it triggers hormonal changes that make your kidneys retain salt and water. The result is a rapid buildup of fluid, even before swelling or shortness of breath becomes obvious. That's why many doctors recommend that patients at risk weigh themselves daily. It's one of the simplest early warning systems to catch fluid retention before it leads to hospitalization. Remember, your weight is climbing quickly without an obvious reason. It's not something to brush off. It's one of the clearest signals your body can give. Sign number 7. Waking up at night to urinate. Here, a symptom that puzzles many people. Suddenly, needing to use the bathroom more often at night than during the day. This is called nocturia. At first glance, you might think it's just age, or maybe from drinking water too close to bedtime. But in many cases, it's an overlooked sign of heart failure. Here's why. During the day, fluid pools in your legs because of gravity and weak circulation. But when you lie down at night, that fluid shifts back into your bloodstream. Suddenly, your kidneys are flooded with extra fluid and start producing more urine. Research shows that nocturia often shows up before other obvious heart failure symptoms. Patients frequently report waking up 3 or more times per night to urinate, with each trip producing larger amounts than expected. It's not just inconvenient, it's a signal your heart is struggling to manage normal fluid balance. Sign number 8. Nighttime cough or wheezing. Do you ever notice a nagging cough that shows up mostly at night, especially when you lie down? This isn't the kind of cough you'd expect from a cold or allergies. Instead, it's a persistent, dry, sometimes wheezy cough that tends to disrupt your sleep. The reason this happens is the same as why people develop orthopnea, which we covered earlier. When you lie flat, fluid that has been collecting in your body during the day shifts upward. A small amount of that fluid can seep into your lungs, irritating your airways and triggering coughing. Some people describe it as a tickle they can't clear. Others say it feels worse in the early morning hours. And in more advanced cases, the cough can bring up a pink, frothy sputum, a sign that fluid has definitely entered the lungs. What makes this tricky is that people often mislabel it as allergies, postnasal drip, or even the air quality in their bedroom. But if you notice a recurring cough that mainly happens at night, it could be your heart, not your sinuses. Sign number 9. Palpitations or irregular heartbeat. Have you ever felt your heart flutter, skip, or pound unexpectedly? These palpitations are more than just unsettling. They can be a sign of early heart failure. When the heart muscle weakens, it may slip into irregular rhythms as it struggles to keep up with your body's needs. You might feel your heart racing even at rest, or you might notice sudden flutters that make you pause. Some people describe it as their heart doing flips in their chest. Research from major cardiology centers shows that arrhythmias, especially atrial fibrillation, are both a cause and a consequence of heart failure. One condition feeds the other, creating a cycle that can quickly spiral downward if not addressed. The danger is that many people ignore palpitations until they become constant or debilitating. But if you're feeling unusual heart rhythms, especially alongside fatigue, shortness of breath, or swelling, it's time to pay attention. Sign number 10. Dizziness or near fainting spells lightheadedness, dizziness, or feeling like you might faint. These can be unnerving, and they're often dismissed as dehydration or low blood sugar. But in many cases, they can signal heart failure. Here's what's happening. When your heart can't pump enough blood, your brain doesn't always get the circulation it needs. The problem is especially noticeable when you change positions quickly, like standing up after sitting. Your body usually compensates by adjusting your heart rate and blood vessel tone. But with heart failure, this adjustment can be sluggish or incomplete, leading to a sudden drop in blood flow to your brain. Clinical studies show that about 1 in 5 people with heart failure experience fainting or near fainting episodes. These can be triggered by mild exertion, standing too long, or even just getting up too quickly. And while dizziness has many possible causes, when it appears alongside other heart-related symptoms, it's a serious warning sign that your heart isn't keeping up. Sign number 11. Abdominal bloating and poor appetite. When most people think about heart failure, they don't immediately connect it with digestive issues. But here's the reality. Your gut is directly affected by your circulation. If your heart isn't pumping efficiently, blood can back up into your liver and abdomen, leading to swelling, discomfort, and a constant bloated feeling. Many people also experience a loss of appetite or feel full after eating just a few bites, a condition doctors call early satiety. Patients often describe it as being uncomfortably bloated, even if they haven't eaten much. Some also experience nausea or pain in the upper right side of the abdomen due to liver congestion. Research shows that these digestive symptoms are commonly overlooked by both patients and healthcare providers. But if you're feeling persistently bloated, losing interest in food, or getting full much faster than usual, your heart could be part of the problem. Sign number 12. Shortness of breath when bending forward. This one is very specific and surprisingly telling. It's called bentopenia. Imagine leaning down to tie your shoes or pick something off the floor, and within 30 seconds, you're short of breath. That's bentopenia. It was first identified in medical research in 2014, and since then, doctors have realized it's a strong and specific marker of elevated pressures inside the heart. Here's why. Bending forward increases pressure in your abdomen, which in turn pushes upward against your diaphragm. If your heart is already struggling with high filling pressures, that extra stress quickly tips you over into shortness of breath. Studies show that about 30% of heart failure patients report bentopenia, and it's strongly linked with more advanced disease and worse outcomes. Healthy people almost never experience this. So if you notice it, don't ignore it. Sign number 13. Cold hands, cold feet, or narrow pulse pressure. The last early sign we'll talk about today has to do with circulation, specifically in your hands and feet. If your extremities are frequently cold, even in warm weather, or if your fingers and toes take a long time to warm up, it can be a sign your heart isn't pumping enough blood outward. This happens because your body, when under strain, prioritizes blood flow to vital organs like the brain and heart, pulling circulation away from the periphery. That leaves your hands and feet chilly, sometimes with a bluish tint in the skin or fingernails. Another subtle clue is something called narrow pulse pressure. Normally, the difference between your systolic and diastolic blood pressure numbers is about 40 mmHg or more. But if that difference gets much smaller, it can indicate that your heart isn't ejecting enough blood with each beat. Both of these circulation-related clues are gradual, so they're easy to brush off. But taken together with other symptoms, they can be an early red flag of heart failure. So now we've covered all 13 early signs of heart failure. To recap briefly: 1. Shortness of breath with activity. 2. Needing extra pillows to breathe at night. 3. Waking up, gasping for air. 4. Persistent fatigue. 5. Swelling in the legs and ankles. 6. Rapid weight gain from fluid. 7. Frequent nighttime urination. 8. Nighttime cough or wheezing. 9. Palpitations or irregular heartbeat. 10. Dizziness or near fainting. 11. Abdominal bloating and loss of appetite. 12. shortness of breath when bending forward, bendopnea. 13. Cold hands, cold feet, or narrow pulse pressure, each one on its own might be easy to ignore. You might blame it on age, lifestyle, or stress. But when you see a pattern or when multiple signs show up together, when it's time to pay close attention. Heart failure is not something that happens overnight. It's a gradual decline, and the body usually gives warning signs well before a major event. The key is knowing what to look for and not dismissing those subtle signals. The good news is that when heart failure is caught early, it's often very manageable. Treatments range from medications that strengthen the heart to lifestyle changes that reduce stress on the cardiovascular system. In many cases, these interventions can slow or even reverse the progression of the disease. So if you recognize yourself in any of these signs, don't panic, but don't ignore them either. Talk to your healthcare provider, share your symptoms, and take proactive steps to protect your heart health.